Hello, my name is Dr. Beech, and I want to take a few minutes to introduce you to my practice. I've been practicing chiropractic since 1984. I graduated from Palmer College of Chiropractic in Davenport, Iowa. I practiced in Lewisburg, Tennessee for 2 years and then came here to the Washington, D.C. area in 1986. I now practice in Frederick, Maryland. And my practice mostly focuses on chronic pain, although I do treat acute injuries as well, but I focus mostly on chronic conditions, pain that doesn't go away as easily. And the way that I focus on chronic pain is to treat mostly postural conditions. I look for imbalances in the whole biomechanics of the body, meaning like a short leg syndrome or the head going forward called forward head tilt or sway back, too much curve in the back. And I look specifically at the feet as a cause for many of these postural issues because posture begins with the feet. And so I treat a lot of patients for chronic pain that's been there for a long time. I also treat accident cases, like car accident cases. I've been treating those for over 35 years now. I'm well versed in testifying in court and depositions and documenting the injuries properly, as well as in the treatment of automobile accident victims' injuries. I also treat extremity problems. People come in with shoulder pain, neck, elbow, wrist, knees, ankles, hips, and I do extremity adjusting and exercises and rehabilitative care for those kinds of conditions as well. I also have a keen interest in holistic medicine and very specifically something called Ayurveda. Ayurveda means the science of life, and it's the ancient system of medicine from India that I've been practicing since the mid-80s. And in Ayurveda, we look to treat any kind of condition. I see patients for, you name it, for skin problems, digestive conditions, autoimmune problems, autism, multiple sclerosis, Crohn's disease, so many conditions I can't even name them all. People come in for just about anything. And the difference about Ayurveda is that we're really focusing on what is the cause of the problem as opposed to just treating the symptoms. So let's say we're treating something like rheumatoid arthritis, where there will be inflammation in the joint. Certainly we do treat the symptoms. We have treatments to help to reduce the inflammation, but also we're looking at what's the underlying physiological cause that's creating this this dysfunction in the immune system where it's attacking the body. It's called an autoimmune response. And so we look to find out what that is. It could be diet, it could be stress, it could be medications that the patient's taken in the past. All sorts of different imbalances can create these problems. And so we look to identify what that is and try to correct it if possible. The way that we use the kinds of treatments that we do in Ayurveda is mostly with food. We use food as medicine. So what specific vegetables, specific grains, how to cook them, what kind of oils to use, what kind of spices to add to them, that type of thing. Also the daily routine, when is the best time, so that we're cooperating with nature. When's the best time to go to bed? When's the best time to exercise? When's the best time to eat your largest meal of the day? Those types of recommendations. And then certainly lots of herbs. You can see these products behind me here. A lot of herbal products that I have for treating these conditions. I practice a very specific form of Ayurveda called Shakavansya Ayurveda, which comes from a very ancient tradition in India, 5,000-year-old tradition, which I learned from my teacher, Vaidya Mishra, who passed away a few years ago. But I studied with Vaidya Mishra almost 20 years, and I practiced his very specific family tradition. And all of my products were actually, all the formulas came from Dr. Mishra and are produced by Dr. Mishra's remaining family in India. So I work in a few different ways. I have some patients come in for chiropractic care, some come in for Ayurvedic care specifically, some come in for both. And it really depends on my patient and what it is that you want as an individual. If you're looking for just pain management, we do pain management. If you're looking for more corrective postural kind of care, then that's what we focus on. If you're looking for a completely holistic approach, then I use Ayurveda. Another aspect of Ayurveda that I want to mention is something called Marma Therapy. Marma are certain points on the body that are energy points, where different types of energies intersect, and we can access those points by seeing the pulse. This is called pulse diagnosis in Ayurveda. And we can access these points and introduce different herbal creams to treat all sorts of different conditions. So this would be very much like you might think of an acupuncturist treating different points on the body, but they use needles. We're actually touching the points and using transdermal creams. This type of treatment I use for all sorts of chronic conditions, but also just for relaxation. It's a very deeply relaxing kind of therapy, and it's very good for stress relief as well. So if you have any questions, don't hesitate to contact us. Our website has a contact form, and you can ask me questions that way. I'm always happy to answer your questions and give you as much information as I can. And thank you very much.